Evening to Netcare CEO Dr. Richard Friedland. He joins us by phone tonight. Dr. Friedland, a very good evening to you. Thank you for being with us. First things first, did you, as the Netcare Group, allow a doctor to continue working at St. Augustine's Hospital even after testing positive for the coronavirus?
Absolutely not. And I want to reassure people out there, we fully understand everyone's anxiety and deep sense of fear. And we are absolutely focused on keeping every single healthcare worker, nurse and doctor safe. And throughout this pandemic, we have not allowed any doctor or healthcare worker to return to work if they've traveled from overseas. And we certainly wouldn't allow anyone to be working on our premises if they were positive. In fact, if anyone is been in contact with someone who's positive, they should be self-quarantining. And we certainly recommend that and demand of that of all of our staff. To the extent that staff are unable to self-quarantine, we are covering their accommodation appropriately so they don't put anyone at risk, because some of our staff members are living under more challenged circumstances, and so we want to make sure that they don't put anyone at risk, and so we're providing accommodation. So the answer is categorically no. We wouldn't allow anyone to work who's positive.
But you have indeed had workers who've now tested positive. Is that number still at 11, as was reported?
I don't know what the exact number is, but it's a very small percentage of the total workforce that we have on the campus. We have about 2,000 people in total on our campus at St. Augustine's. It's a very big hospital, but as a precaution, we are testing everyone. Now, when these 3 patients who came in who were not COVID positive but became COVID positive, in other words, they weren't in our COVID positive ward or they weren't persons under investigation or patients under investigation, we worked very closely with the National Institute of Communicable Diseases, the NICD, whose advice was that anyone who was in close contact should be quarantined, and we did that. We're now taking the additional step of saying, notwithstanding those that were in self-isolation, we want to be able to test everyone and reassure them as to their status and provide whatever care we can in terms of whether they're able to quarantine or not.
But Dr. Friedland, forgive me, but when you see reports that about 11 healthcare workers who work for the Netcare Group at this one hospital are said to have tested positive, excuse me, for the coronavirus, surely it is your responsibility as CEO and the rest of top management to make sure that you have exact figures so that you are able to get on top of this problem.
Actually, this is an evolving situation with respect, and we do take absolute responsibility, and I don't have that exact number with me at hand. But I can assure you we're doing absolutely everything in our power. Now, let me come back to that, sir, if I may. We have adequate PPE. We have spent as a group over 300 million rand in terms of bringing in at exorbitant prices, I might add, the required personal protective equipment for our staff. In fact, the level of PPE we have throughout Netcare is higher even than the World Health Organization guidelines, in the sense that we are ensuring that everyone in our hospital at least is wearing a surgical mask. That's certainly higher than the World Health Organization guidelines. And in terms of the exact statistics around the number of COVID-positive patients, we are duty-bound by the Department of Health, that they are the ones that actually release this data to the public. We are not allowed to be issuing exact numbers and statistics without the permission of the Minister of Health.
But Dr. Friedland, forgive me again, as the CEO of the Netcare Group, on the 3rd of April, that was when the first report was published, quoting the KZN Premier saying that 11 healthcare workers had indeed tested positive for COVID-19 at a private hospital, which News 24 said at the time they understood to be St. Augustine's in Durban. When you see those reports come out on the 3rd, we're now on the 6th, surely, apart from the guidelines or protocol about who's supposed to communicate on the overall number of infections, as a group, you have a responsibility to collate and update your own data so that you are able to allay the fears of your patients and other workers especially.
So I think we do collate them and we are updating them. and we're still awaiting tests to come through, and all of that information is supplied twice a day to the Department of Health and the NICD, who are the governing bodies and the controlling bodies in terms of all statistics related to COVID virus in South Africa.
What was the last number supplied from your hospital?
That's for the Department of Health and the NICD, as I mentioned earlier to you. We cannot even release if there has been a death due to COVID, because it is up to the Minister of Health to release that data.
But Dr. Friedland, I understand that again, but you've got a situation where healthcare workers in various parts of the country have been saying that they do have an issue around a shortage of the personal protective equipment. You've got patients who at some point may have to be admitted at this hospital. And I put it to you that it's purely unacceptable to then say tonight that you are A, unable to confirm the earlier figure of 11 reported infections among your staff, and B, you're unable to give us the latest numbers.
I think I've made my position very clear. I think we've made it very clear how much we're spending on PPE. I certainly can't speak for other providers or the Department of Health. I can certainly tell you that the level of PPE that we're providing is in excess of the World Health Organization, and I can reiterate that we will leave no stone unturned to look after our healthcare workers and give them every reassurance. We're communicating with the unions in this regard. We have a national meeting that I'll be addressing tomorrow with all of the unions. We've been absolutely transparent in terms of that. But what I am saying is that we are collating all of the data and sending up-to-date responses to the NICD and the Department of Health.
Are you able then to understand the complete anxiety and lack of faith in your institution at this point, given just the lack of clear facts and figures around this?
With respect to actually, we've had enormous amounts of support from people on the ground, from the broader public, and from a number of our staff to say that they actually do feel very safe. And we've had broad spectrum support across South Africa, because we've been preparing for this for months now, since the 15th of January. So whilst I understand your own personal concerns, and I respect them, I need to tell you that we've had broadband support from doctors, from nurses, and unions.
It's not my personal concern, sir. We've had Denosa come on ENCA and say they are not pleased with the way things are going. So it's not my personal concern.
I understand that people are very concerned out there, and there is a heightened level of fear, and I think that that is generally justified, given how dangerous, how insidious, and how invisible this virus is. But we are doing absolutely everything in our power to ensure that our workers and our doctors are completely safe and protected. We're even going to the additional measure that if anyone needs to be isolated and cannot be self-isolated safely, in other words, they're in a dwelling or a shack or in a informal settlement, we will cover the costs of an appropriate self-isolation for them. We've made that abundantly clear, and we are prepared to do that for any one of our healthcare workers that finds themselves in that situation.
Okay, so then can you say tonight, Dr. Friedland, that each and every one of your staff at these hospitals that you are running has enough protective equipment?
Yes.
Okay. Dr. Richard Friedland, CEO of the Netcare Group, thank you so much for being on ENCA tonight. Sally.
You know what I don't understand? I understand that everything has to go through the National Institute of Communicable Diseases. We don't want wrong numbers getting out. But what I don't understand is whether he could not at least confirm or deny that 11 was a correct number or not. But anyway, hopefully we will get an updated figure from the NICD on just how many healthcare workers at St. Augustine's Hospital.
Because it is a worrying situation. Everyone is very anxious about which way this is going to go.